Good morning and thank you for joining us today for this Euractiv 3M event, where we're going to be talking about how to secure Europe's future through the EU Stockpiling Strategy. We're going to look at how to tackle the health challenges that we may face and how to build resilience. Now, the EU Stockpiling Strategy and Medical Countermeasures was announced in July as part of the wider Preparedness Union Strategy. It's going to be all about getting access to critical resources, particularly in times of crisis. It covers many sectors, but we're going to focus a little bit more today on the question of personal protective equipment. We'll also talk a little bit about medicines and vaccines, as well as the stockpiling of medical countermeasures. Following the COVID-19 pandemic, of course, the Health Emergency Preparedness and Response Authority, HERA, was set up. We'll be talking about that. We'll also be looking at the public-private partnerships and the very key role that those can play, as well as the legislation and all the framework we need to develop around EU's future stockpiling mission and what it can deliver for the future of Europe and its resilience. We're very pleased to have a wonderful panel of speakers today here from the European Parliament. For those of you who wish to ask questions of our panel, we will try in our time to get the questions to them. You can type the questions in the box there on your screen, or if you want to use your smart device, go to slido.com and enter stockpiling, and there will be an option there for you to put your questions. So let me introduce you to our speakers. We have Anne Simon, Head of Unit from DG HERA in the Emergency Office at the European Commission. Thank you very much, Anne. We're here in the European Parliament. We have two MEPs joining us with a particular interest in the health sector. Nicolas González Casares, who is in the Sant Committee, of course, and also in the Sant Committee, Tomislav Sokol, who is Rapporteur for the Critical Medicines Act as well. Also joining me, Dr. Christian Kaiser, who is the immediate past President and Working Group Chair on the Pharmaceuticals and Healthcare Products Standing Committee of the European Doctors, CPME for short. And last but by no means least, Maxime Bureau's Government Affairs Director at 3M, who will be able to tell us about that private-public partnership element as well. Anne, I'll turn to you first. I mentioned HERA at the outset. Give us a little bit of an opening statement. Tell us what your focus at the moment is.
Yeah. Our main focus at the moment is, as you mentioned, the implementation of the Medical Countermeasures Strategy. The Medical Countermeasures Strategy has been adopted in July 25 as one of the first action stemming from the Preparedness Union Strategy. So what we are aiming with this strategy is to ensure the availability and access to critical medical countermeasures in response to health emergencies. So what we mean by ensuring the availability and access to medical countermeasure, it means that we want to look at that from a hand-to-hand approach. It means that we want to make sure that there is innovation, that there is research, development, production, stockpiling and deployment of medical countermeasure. This ambitious strategy is also presenting two very important annexes. One is about the threat prioritization, what are the health threats that are coming our way, and the second annex is about stockpiling. So under this annex, we are trying to look at what is needed to ensure an effective and efficient stockpiling of medical countermeasure. So I will not enter into the details right now. We will have the opportunity to answer a question about that. But this annex is very important to ensure that this stockpiling, which can be considered as an insurance, is sustainable in the long term.
Thank you. Nicolas, you've got a particular perspective. Tell me, what is your focus when it comes to this stockpiling question?
First, let me say that the pandemic crisis revealed for us one truth for Europeans. We faced broken supply chains, lack of masks, ventilators. So therefore it was clear that we have to act. The Commission created HERA, the Authority for Emergencies and Response. We want a strong HERA, not a weak one. And we have to act right now being better prepared. Stockpiling is important, but also manufacturing. So I cannot understand stockpiling without the side of manufacturing. And manufacturing is possible in the EU. This is one of our objectives in this discussion, how to achieve enough autonomy, not the whole autonomy, because it's impossible. We are interdependent with other parts of the world, but at least some autonomy to face new threats and challenges in future and don't run like a little bit crazy searching for masks in one part of the world and ventilators in the other or whatever. So this is an opportunity to think, to create new solutions, to have a wider toolbox to respond in these situations.
Absolutely, we will talk about production and manufacturing. If you don't produce, then there's nothing to stockpile at the end of the day. Tomislav, give us your perspective. A lot of this grew out of the COVID crisis, but where are we now?
Yes, definitely what we saw in the beginning of COVID crisis is what happens when you don't have enough coordination, when you don't work together, but each member state is working individually. And especially in the beginning, when we had the crisis in northern Italy, for instance, and certain member states were not really willing to export some of the medical countermeasures that they had at their disposal. So this is something that cannot happen. So we cannot have a situation that in case of crisis, it's each member state for its own. And for me especially, this is important because I come from a small member state, and of course with small member states it's an even bigger issue because we definitely cannot have stockpiles for everything. So this common European strategy, common European coordination of stockpiles, but also common European stockpiles when necessary are essential. So I think we've come a long way. So we strengthened the mandates of EMA and ECDC, also created HERA as was already mentioned. We have much more sharing of information. We have much more coordination on European level, and definitely these new strategies have also been a step in, I would say, in the right direction.
Thank you. Christian, I'm sure you agree with what you've heard so far, but give us your perspective coming from CPME.
Sure. Yeah, for a short introduction, CPME is the organization that is representing the medical associations in the European countries. So medical associations, medical chambers like it. Therefore, we're very much involved in these kind of topics. So we're part of the HERA advisory group. We are part of the European Medicines Agency Professional Working Party. But especially on stockpiling, we also saw in the COVID crisis at the beginning that if you start stockpiling on a national level, you create shortages for your neighbors. So that's the most important danger thing in stockpiling. And some initiatives have been taken, especially by HERA, on coordination of these items. So what we actually need is that we have sufficient stockpiling for critical medicines, for example, for 2 months, but then on the European level. So then also the national authorities need to communicate with each other or with a coordination group on that topic, so to prevent shortages in other countries.
We will come back to this idea of collaboration and functioning at an EU level. Because there is a tendency that we think in terms of pandemic, where there are, of course, crises that maybe within countries that need support from their neighbours. Maxime, perhaps to start us from your side, for those who don't know, tell us a bit about 3M and how you are relevant to this discussion.
Yes, thank you, Jennifer. Thank you for the invitation and to be all together here. 3M, indeed, you know us, we do post-it notes, that's nice, but that's why we are maybe invited to this session this morning, is we do many things to serve the industry, to protect workers in the industry. In healthcare, we have been I have eminent healthcare practitioners around the table in your different capacity. We have been serving also a lot in the energy sector, transportation, and digitalization a lot, data centers, semiconductors. So that's indeed you were mentioning manufacturing. We are indeed 13,000 employees in Europe with more than 20 manufacturing sites. And the objective as a member of the operating committee for EMEA is how we strengthen through legislation, through public policy, how do we strengthen actually our manufacturing and our servicing of our customer here. One command I can tell you is definitely we work with all of you and with the Commission. I think we did the first tender, which was a joint procurement agreement in March 2020. And we were very happy at 3M to be given the mandate to lead and when we won this JPA. And it has been indeed, as you said, very important to connect the dots. And I think that will be the point of this conversation this morning, is how can we continue to connect the dots. I can give you feedback later. It has not been easy, but it is indeed possible, and that's the good news.
Thank you. So I think we've set the scene quite well there, and I feel like we should identify some key challenges which include limitations in national capacities, which you mentioned, Tomislav, the need for a robust EU-level coordination and governance, and then also funding. let's start with that last one first. So how does EU legislation and the funding mechanisms support health emergency preparedness? Tell us, what role does HERA play, and then I'll come on, gentlemen, to talk a little bit about the Multiannual Financial Framework as well.
So we have now two major legislation that are supporting the preparedness and response to serious cross-border health threats, which is the Serious Cross-Border Health Threat Regulation and the Emergency Framework Regulation. So we have a set of articles and legislation which support the activities, our activities in the field of research, development, production, stockpiling of medical countermeasures. HERA has also been granted with a budget to cover its activities under the Horizon Europe, the EU for Health Regulation, and under Next Generation EU. So we have, thanks to that budget, we have been able to cover the objective and ambitions of DG HERA. The question now, we are discussing now the future of the budget under the next multi-annual financial framework, and the objective is to ensure that we keep a certain level of flexibility to address the different threats that are coming our way, in order to be able to adapt to those threats. But also we want to make sure that the support to health can continue.
Thank you. Nicolas, tell me a little bit more about the question of funding and how legislation supports that. We're also looking ahead at the moment, at this point in time in the EU bubble, towards the MFF, and what's the role there?
Today is a very important day because we are here in the Parliament and we will have a plenary debate about the MFF. And I have to say that it's very important for health to be in this debate. I think we have made a great progress in the last years. After the pandemic, we really reacted in order to create a regulatory framework that enables the possibility to have stockpiling, to have a better production in Europe. I think that we have good financing because not only the EU properly instruments, also Next Generation EU was very well used in some countries, increasing the possibility, for example, of manufacturing vaccines. We have the EU FAB network that was created across different member states. So it's time to claim also to the Commission that the good MFF is an MFF that have a good response to all the health challenges. And without taking this into account, we won't have a proper, good MFF. Yes, we have these national envelopes, but could be very dangerous. There are other priorities, it's true. We have security priorities, but we cannot forget that health, stockpiling, and manufacturing are also security priorities in the EU in these moments. So this should be taken into account in this debate of the MFF.
Thank you. Tomislav, your thoughts on this as well. What role does the MFF proposal play? Are you optimistic that we will get it right? I mean, this is a long-term budget, and when we talk about crises, they tend to be things that we have to have very fast reaction to.
When we speak about EU action, MFF is crucial, so you cannot do anything without money, right? And if you want to know what politicians' priorities are, just look at the budget. Don't listen to what they're saying, because they'll say a lot of things. They'll try to appease everybody, but when you look at the budget, you see what they actually want to do. When we speak about MFF, the part on preparedness in general, so about civil protection and health emergency preparedness, is quite well. It's around 10.7 billion euros. It could be more, but we have some dedicated funding, which is fine. For me, the problem is health in general. So for health funding is a major issue. In the previous MFF, the 7-year budget for uninitiated, because we like to talk in these abbreviations, etc., in these phrases that nobody really understands out of the bubble. So when we speak about the 7-year budget, in the previous 7-year budget, we had a separate program for health, which originally had more than 5 billion euros. Then we lost 1 billion because of the war in Ukraine, but still it was pretty significant. Now in the new program, we don't have a dedicated EU budget for health anymore. So we have part which is under the so-called competitiveness fund for innovation, for boosting pharmaceutical and medical devices industry and things like that. The other part, and research, the other part is under the preparedness that I already mentioned, but it's not ring-fenced. That means that money can be taken from health and given over, reallocated for something else without really some kind of proper procedure. So it can be decided by bureaucrats in the European Commission, and this is not something that we support. So if we want to retain health as one of the priorities, health needs to be ring-fenced. This part of the budget for health needs to be ring-fenced. The same as agriculture asks for agriculture, that at least part of it is ring-fenced, which means protected, that it cannot be spent for anything else unless we change the whole setup, the legislation, which is then a separate procedure, and then this is much more serious. But it cannot be changed on a whim of somebody in the European Commission. So that is essential, and this is something that we have to fight about, because this budget, this proposal from the Commission is sending a wrong message. And the message is health is not as important as it was in the previous mandate. Or in other words, health was only important during the pandemic. When we had the crisis, it was important. We created EU for Health program, we created HERA and everything, but now when there is no emergency, we go back to business as usual, where health is a marginal topic in Brussels. And that's a wrong message to send, and this is why we have to fight. And I count on my colleagues from other political groups like the S&D as well, the socialists, to also support us on this.
Well, I mean, as you say, health was never normally on the agenda in Brussels because it was always seen as a national competency, and of course the pandemic has changed that very clearly. But health is also quite difficult to define. I mean, we can talk about questions of medicines, of pharmaceuticals. I'm seeing here from our audience online, Nolanda van Vel van Haar, thank you, is saying that medical nutrition is also a critical part of this sector, and we need to advocate for policies that provide that access as well. And then we also have the PPE, the personal protective equipment. Tell me, I mean, from a doctor's point of view, clinician's point of view, are we on the right track with this? Are we directing funds to the right areas? Because when we talk about stockpiling in the EU in general, it includes other things, including food and water and energy, which are all part of supporting people who may be in health crises.
Yes, of course. I totally agree with Thomas Lasokol, and we discussed about it. That one of the main things is that the budget before the current budget also didn't have any health budget in it, and then in this current budget, we had this funding for health, dedicated funded for health, and I'm personally convinced that because we had this budget, we could cope with the COVID crisis. So that's one thing. On the other hand, we also saw all kinds of initiatives where we invested money also on research, on topics on medication, development of medication, but also on things on healthy nutrition and prevention of diseases. So that's a very important thing. And so we're also very concerned about that now that this has been moved out of the budget. So where you have to discuss if we are capable of managing a new crisis. So if you look at the topic, so I think we have quite some things in place on preparing for new emergencies, like on stockpiling medication, but also on personal protective equipment, because that's what we have learned in the COVID crisis. But what I'm especially concerned about what we saw after the COVID crisis, that everybody started first again with stockpiling on a national level, and then because of HERA and because of the development of the Critical Medicines Act, we are now moving again on coordination. On the other topics, if you don't have budget on that, so also if you're looking to, for example, for topics on healthy living, which also is a very topic, everything on the discussion on the environment, it also has health consequences. We also have to do some things about that, and without a budget we cannot do anything on that. Also on production facilities, which is an important thing on in the shortages, we're heavily depending on everything outside of Europe. So if we're not going to do something about it to create more production facilities, and that's not only the end product but also raw materials, then we will not manage also these things on shortages. So there are a lot of topics on where we're concerned about. So we're also talking with the SAD committee on that. and totally supporting their initiatives to have more dedicated budget on that. And then if you're looking at water, but also on food, yeah, that would be the next step. And then I think we have to discuss also that, do we need initiatives on that with HERA, for example?
Maxime, from your perspective, what is the role of EU legislation in helping to support the production so that we have these goods to stockpile, these PPE?
I think the European Union and the legislator here, the Commission, the Parliament, have a fantastic opportunity with this new MFF. You see 3M, for example, we produce this famous PPE, personal protective equipment, in different sectors. We are respiratory, hearing, eyes, head, fall protection. Okay. So, but what was very interesting is when happened the COVID-19 in March 2020, actually the first supply was respirators. And it's critical, I think we need to learn the lessons. Simply, you need to have proper respirators to protect your healthcare workers, otherwise they cannot help. We saw it very simply, the other healthcare workers and the patients. So we need this FFP2, not surgical masks, which are protecting only, the patient. You need to protect the doctor themselves first, and the nurses and all the people who are helping here. So for us, our observation is this is a great opportunity with the MFF. Rescue was interesting. HERA was great to come to centralized, but indeed it was really how we catch up with what we have. And I think that's where we have a great opportunity is we have learned that. To come back to your point, I think the Commission has done a fantastic work in the last years, especially this year. You have all the strategies on the table. Everything has been put on the table. So now we need to deliver. We have the opportunity to deliver. I see in the medical countermeasures, you have these famous PPE, which are included. Perfect. You need these respirators. I mean, we can deliver and sell many different solutions, but we know that we see this one in terms of crisis. This is the one you need first. So I think our MEPs were very right. I mean, we need to have one budget line, which you did not have in the past. And indeed, you can have maybe a big one for healthcare, but you need a sub-line of very clearly, which is for pandemic preparedness and dealing with pandemics, because then we can touch any of you. We served Spain, we served Croatia, and the other countries through rescue, but it has been long. Indeed, we lost probably 6 months, so 6 to 9 months. So concretely, we have this opportunity. Let's have a one budget line. We see the framework is already there, the legislation. We just need to execute and to have the implementing act. But a lot of good things have been done. It's a time to deliver for protecting European citizens.
Can we give one example? Yeah. From the beginning of the COVID crisis, what we clearly saw when everybody independently started stockpiling, we had countries where we had sufficient of PPEs. And in these countries, for example, in my own hospital, in the ICU, we saw that the healthcare workers weren't infected with COVID. Yeah. And where the shortages were, for example, in elderly care, but also in the south of Europe, then we lost healthcare workers because they got infected with COVID. And only after we coordinated it and started joint procurement and could rearrange all those PPEs to all the countries they needed, then we saw improvement. So we learned from that, and then we should now take the next step.
Maybe just to clarify on the funding. So we have in the proposal the Union Civil Protection Mechanism, so we have dedicated funding for that. So that part is, let's say, fine. It could be more. Let's say, but okay, in case of crisis, of course, funds can be gathered from other parts of the budget, from other sources, etc. But for health in general, there are also some other measures which are not strictly civil protection measures, which are related to health, but for which we don't have this clear ring-fence funding, which is and health in general is a problem. So preparedness, at least in that part of civil protection, is fine, but health in general, which includes public health measures, and a lot of other activities, that's the issue where we have to do more.
Well, let's park funding for the moment, Tomislav, because I'm coming back to you to talk about stockpiles, on logistics, and how that coordination is happening. And I see Ines Vindic, who has asked a question specifically, saying that the reality shows, unfortunately, that there is fragmentation in stockpiling. How do we overcome this so that small countries are not suffering? Stockpiling finished medicine products is not the solution, as it might just drive up waste and destruction. There is a balancing act there to be had, and it takes into account supply chains. How do we manage that, and how are we currently trying to manage that?
I would say there are two main mechanisms in general, in principle. So one is a better coordination of national stockpiles, so that we don't have a situation that we have lacking something in one member state during a crisis, that we have shortages while we have stockpiles of the same thing in another member state. So we need coordination between different member states, and also I would say as a last resort, we also need common European Union stockpiling. So I think in principle these are the two main mechanisms. And if I can maybe move to the medicine specifically, because we are currently working on that. I'm the rapporteur for Critical Medicines Act. This is precisely what we want. So our proposal is to create first a system of exchange of information between the member states and coordination at European level, so that we know what is in stockpiles in each member state. Both contingency stocks of medicines. These are stocks of medicines which are kept by the pharmaceutical companies on behalf of the member states, and national stockpiles which are kept by the member states themselves for security reasons, etc. So first we need coordination and exchange of information on that, and then what we are proposing, and we know that there is opposition from some member states on that, is to create a redistribution mechanism across the EU. That would mean that in case of crisis, if there is a shortage of a certain medicine in Bulgaria or Lithuania, and this medicine is on stock in France or in Italy, that the decision on a central level from the representatives of the member states can be made to reallocate this medicine to the area where the shortage exists. This is something that is not the priority for all member states. Smaller member states obviously like that, but there are some member states who keep stockpiles even for 6 months in advance, and this is something that definitely contributes to having shortages. So from those member states, we hear that there could be opposition to this common European system. So what we need is we need exchange of information. We need to control that national stockpiles do not create shortages in other member states. So this is why we are introducing a special provision in the Critical Medicines Act that any national stockpile must not lead to shortages in other member states. We are creating this exchange of information and this redistribution mechanism that, as a last resort, if there is no other way, medicines can be redistributed to the area where the shortage exists. So this is something that we need, and of course, in very specific circumstances, EU stockpiles of medicines can also be an option, but that's also something, if there is no other way, definitely that can be the very, very last resort, I would say. So we need both. So both coordination of what we have on national level, because national stockpiles are still a national autonomy, because member states can still decide what to have on their national level, providing that they are not causing shortages in other countries. But in case of crisis, we need coordination, we need redistribution, we need solidarity, and we need for these medicines, now speaking primarily about medicines, get to the patients which need them the most.
Well, I think what you're identifying there, if I'm understanding correctly, is almost like a two-pronged problem. One could be on a political level. There may be fear, there may be a need to a national level, thinking that we need our own as well. But there may also be a question where there's room for innovation in how we coordinate this transborder support. I mean, that was my next question. How can the EU's managing of stockpiles and logistics innovate? Is there a need for innovation? Is there a need for change? Or is it more of a political problem, Nicholas?
I think both political and technical. I think that it's true that Sokol said that we need a better coordination in Europe and better information across member states. Stockpiling cannot be unlimited. And it's true that in the first moment of the pandemic, we have seen that some countries accumulating a lot of stocks of some products, probably face masks, ventilators, and so on. So this is not a real response, not a real European response. I think that with a better system of information that HERA can provide and has also the obligation, but also with transparency, because we citizens have the right to know what is happening with our medicines or with our stocks of medical devices. So this is real important for us. But then we know that it's not enough. Information is true, it's key. Transparency is an enabler, but of course we need procurement. We need these PPEs functioning. We also said in the Critical Medicines Act that we can go for joint procurement with a coordination or under a request of some member states. It can help in this situation, not as a silver bullet. It's not going to work for every situation, but it's true that there are some countries that have more difficulties than others when they go to the market and try to buy medicines, mainly medicines. But also, when you have a crisis, you have problems with other medical devices. And I think this is also a good response. Like having this possibility can be a good tool for member states to claim in difficult situations. And I think that we need a balance of the different proposals and the different tools in the toolbox that can be used. But don't forget that the real issue, MFF, is quite important in this moment. Without dedicated funding for health, properly health, we won't have the same response. We need this funding. We need this. Health priorities in the EU can no longer depend if we have a pandemic or other health crisis. We have to maintain a certain level of stockpiling and manufacturing for the whole time, not waiting for the next crisis. This is very important.
I mean, and this is central to what you're actually working on. I mean, obviously funding is key, but we also at a certain level need governance and this coordination that we've all been talking about. So how is the EU currently managing the stockpiling, the logistics? We surely have the digital technology there to make these things transparent and smooth. How is that working, or does there need to be more work done on that?
Yeah. So in HERA, we are focusing mainly on serious cross-border health threat and medical countermeasures to address those serious cross-border health threats. So the stockpile that we are managing are focusing on those threats, which are quite sensitive because we are talking about chemical, radiological, and nuclear threat. We are talking about threat like Ebola or Marburg, which are very sensitive even for the broad public. So we are focusing on those stockpile. We are working very closely with DG ECO in the establishment of rescue stockpile, and we have identified with them different scenarios, like nuclear scenarios, radiological scenarios, for which we would need medical countermeasure. And that's why we have established a 1.2 billion euro stockpile. So those stockpiles, we know what's in it, but we cannot, for strategic reason, we cannot even disclose all the list of all the medical countermeasures that are available there. This said, it's very important before establishing a stockpile to understand very clearly what we need in the stockpile. And here we are taking in HERA a layered approach. It means that at EU level, we cannot cover for all the threats, we cannot cover for all the needs of the member states. And we are working very closely with the member states in defining what should be stockpiled at what level, what exchange of information is needed to secure that we are not duplicating, that we are not leaving gaps in the response to those threats. So we are funding a project with member states, and almost all the member states are participating in this project, which try to address this layered approach to stockpiling. So in this project, member states will exchange information about their stockpile. They will set up 90 tools also to make sure that they communicate between themselves. They will identify what are the medical countermeasures which should be stockpiled at local level, regional level, national level, or EU level. So I think that's really the first step that needs to be taken to ensure that we are really covered at all the levels and that there is no duplication, that everybody bears their responsibility. And we, at the EU level and Commission level, we can take care of those threats that we are so improbable and but very high impact that member states cannot cover for them, so don't have the means to cover.
Maybe if I can just step in, maybe just to clarify one thing. We have separate legislation on medical countermeasures, which is broad, so it covers personal protective equipment, masks, ventilators, etc. And the separate issue, specific issue, is medicines. So this is regulated in a bit of a different way. So these things are not completely intertwined. So just to explain, when we speak about medical countermeasures here and regulation of medical countermeasures, we are primarily speaking about personal protective equipment and things like that. While for medicines, situation is a bit more complex, and now we are working on the Critical Medicine Act to actually cover that fully as well. So maybe just to clarify the terminology.
And there's a question, I think you've already slightly answered it, but it's come in from Bernardo Rodriguez, asking, can you clarify how the list of medical countermeasures is put together? Obviously, Bernardo's particularly puzzled about blood and blood components are not considered on the list, considering their importance in a number of emergencies. Can you just explain in a little bit more how things are listed and not?
The starting point is the identification of the threat that we will need to respond to. So in HERA, we are dedicating a lot of efforts in identifying those threats. What are the priorities that can be established among those threats? And based on that threat, we are looking at what are the medical countermeasures that are needed to address those threats. We will assess through roadmaps what are the medical countermeasures that exist, that are available, that have been approved at EU level or at national level, and those that do not exist that would need to be developed. So we will base our action on those different medical countermeasures. For stockpiling, we know we are focusing on those medical countermeasures that do exist, that have received an authorization, and we are drawing a list of those medical countermeasures. And what we will be doing in the coming months is to look at different criteria to see whether those MCMs are worth to be in a stockpile. For instance, if we are talking about a medical countermeasure that needs to be injected within 4 hours into the patient, we cannot have them in a stockpile. It's not cost efficient to have something that needs to be delivered very quickly. So we are looking at those type of criteria. What are the stockpiling conditions? So these are criteria that we will assess, again, each MCM to see whether they can be stockpiled, and if yes, then we will discuss with the member states where it should be stockpiled.
Maxime, now let us turn this around too, because we were talking here a bit about transparency, about distribution, and I mentioned innovation and logistics. This is somewhere surely that the private sector, you have insight into how fast things can be produced and to what level they can be, and you understand supply chains. Tell us where the private and public come together and how you can help with some of the challenges that we've identified.
Yes, thank you. I think they come obviously together here because we need, from the conversations this morning, it's clear that we need an EU-wide PPE capability because we need to have it at national, and then we need an EU reserve. And I think that's the purpose of HERA, DG Sanco, and the European Commission. So first, let's have that, from the private sector. It's where we can serve you in the member states, but we should have a reserve at EU level, definitely. I want to tell you also, in terms of transparency, information sharing, I think we can all agree that we can do better. What we learned is really during crisis time with COVID. Information was really we were talking to the Commission directly every day because they were calling us also. So it was efficient as we could, but we could do better with a more processed transparency on exchange of information, and we do that with the HERA and the other services. But we are happy to meet with our experts, so also the member states and the Commission can have more information on the innovation which are coming. We can also listen to the needs more appropriately. Thinking about one comment of the COVID, I remember the discussion in March 2020, and I'm sorry to come back 5 years earlier, but it's important because we were in the middle of the crisis. We were manufacturing 3M in the UK and in Sweden, Slovakia, and not Germany at that point. We had trade barriers from the UK to serve the continent. So, and I remember big member states, which I will not mention, were actually refusing to export, for example, to Switzerland or to Norway, some respirators. So I think what we really appreciate also that in the discussion is a European Union manufacturing base, but let's think maybe Europe, especially with the discussion we have with the war in Ukraine. It's not only EU, it's Europe. So let's include the EFTA countries and let's include the UK probably in this conversation, because then we have more capability to serve all together. So that's one thing I wanted to flag today to do. We can continue on public-private partnership, innovation. I can tell you, if you want, later this morning on what we think we need in procurement to fly to quality. I think you have an opportunity also with the budget to fly to quality. During the COVID, I had some European Commission officials nicely who called me and said, Maxim, we see there is a 1 billion coming from a big third country of Asia. Are they good? Well, we cannot tell you, but it's not possible to have 1 billion like this of high quality PPE when you are in a crisis. So that's why we need indeed market surveillance. That's why we need certification. We need high standards in the public procurement, in the tender from the Commission or from the member states. So the member states and the Commission do not come with stock which are not useful that you can unfortunately throw away.
We have seen in various countries crises and scandals around the quality of PPE equipment during the pandemic. So quality, product compliance, all of these elements come into the idea of manufacturing. And one of my questions was, how does local production relate to, well, obviously it relates to Europe's competitiveness, but what can the EU do to strengthen this, and why is this important when it comes to planning and preparation? Nicola,
do you want me to add on that, maybe?
Yeah, of course.
Or I kick off for
Go ahead.
our MEPs on the Commission to follow up on that. For us, as we see, is really quality. If 3M lose a tender against somebody else who brings more quality, we accept it, because that means we need to do more innovation, or we need to provide you a better service. That's very fair. What we have seen, and we discussed that, we had a constructive discussion with the Commission, is if you do only on price, if you take the cheapest, well, you will not have European manufacturing. I tell you straight. It's very simple. We are in 4 member states. It's very difficult to keep the manufacturing here if we don't have tenders who are asking for requirements or criteria which are focused on quality. For example, just quickly, we talk about sustainability. Well, you have an opportunity, sustainability, durability. You can ask, in the tender that you could have put on the shelf your PPE or respirators for 5 years. If you do it for 5 years, it means that you have a quality product. Otherwise, you cannot do it. We could ask also life cycle analysis or, environmental product declaration to the person who is providing this respirator. Then you ensure quality. A third one, and to stop with that, to let the floor to others, feed testing. Unfortunately, we have different morphologies. It's normal. Yeah. So you need maybe to have requirements focus on, again, feed testing, so that people have to try. So you are sure that the PPE that we can give to the doctors, they are fitting them. They are not provided by the Ministry of Health from their country with a product which is not fitting. So, and last but not least is certainly certification, notify bodies in Europe that we need to help. So they focus on high standards. We are for high standards. We are for certification. This is the only way to ensure that you have the best price for the quality you deserve.
Yeah, but then also in general, we should also come back from this everything on procurement on price.
Exactly.
Because we have quite some experience also, and especially for medicines, as I look at my own country, always buying the lowest, for example, paracetamol for the almost lowest price possible. Then what you will see is that when you pay the lowest price, then in the Netherlands we're the last in line to get the product delivered, because they will prefer to go to other countries. And then what you always see is then that's only possible if you produce it outside of Europe. So there's a general discussion on that, and we discussed it also with several MEPs that we also need, but it's also a discussion on a national level, that we need to be capable of paying a higher price for general products and medication to have enough production also facilities in Europe. Because that's really a main topic. If we want to every time go for the lowest price, production will always keep happening in India and China, the lower income countries. So that's real, and that's a discussion we have to do all together. But then we also, as a citizen, have to be ready to pay a higher price for those products.
Well, I think this is key about explaining to the citizen, because of course, if you're spending public money, you have got an obligation to spend it responsibly.
Yeah.
But then again, if you're a frontline worker or a clinician, you want to know that your PPE is going to work and that you haven't just got the cheapest and not necessarily the most effective protective equipment. Nicolas.
I have to say one thing. I worked many years as an emergency nurse. If I run in an emergency, I'm not doing the things very well. I have to walk during an emergency because I have my crisis preparedness before. So if you are running during the crisis, probably you are having some problems.
Yeah.
And when you are looking for products in a crisis, running from one side to another, probably you won't find the best quality for your patients and for the people. So we need this quality assurance. And this quality assurance comes when you have enough manufacturing capacity. So manufacturing capacity is a win-win solution because you have good quality products and also made in your industries. So this is real solutions for all Europeans. And how to do that? Of course, financing is important, but also in the public procurements, we need clear conditions that gives to the public administrations and to national health systems the ability to buy things that really worth the price that is needed in these cases. So we have to give also the citizens that we are avoiding also corruption, but corruption was clear during some times in the COVID crisis in different member states. We avoid corruption, but also we are giving the best to the patients and with a good crisis preparedness without running from one place to another and paying higher prices for things that don't have this price, that are cheaper than the money you have to pay in this moment. So I think the role of the Commission in this case was increased during the pandemic. You have higher responsibilities, but we cannot forget member states because public procurement is made mainly by member states and regions. We cannot forget these obligations.
Well, I'm going to turn to the joint procurement agreement and let's talk about how effective that is. I mean, HERA has a role with recommendations. Does HERA need a louder voice, or more than simply recommendations? Or what's happening at the moment in terms of how that's working?
Well, it's true that since the creation of HERA, we have implemented several joint procurement, and we see a lot of advantage to joint procurement because it improves the bargaining power of the member states and the union. It improves the cost efficiency, and more than everything, it gives an equitable access to member states to some of the essential medical countermeasures. So we have seen with the several emergencies that we have had since the creation of HERA that some member states do not have access to some manufacturers because they are too small or the capacity of the manufacturers are too small to accept even a phone call from a smaller member states. So it was the case during the Mpox outbreak, for instance, where there was a very small manufacturing company that was producing the vaccine and some member states could not get on the phone to that company. So with the joint procurement, we are gaining that capacity to offer to the member states, as many member states as they want, to offer that access to those medical countermeasures. Of course, it also the other advantage that it has a very firm and a very clear framework of implementation. It's transparent and structured, so everybody knows what's in it. So that's another advantage. It covers a quite broad number of member states also, and countries outside, so EEA countries, for instance, and countries outside of the EU. So we see those advantages. Of course, it can be improved, and we are looking at that. But for us, we are very happy to continue with that approach.
Tell us, Maxime, how effective is it from the other side of the fence?
Look, I mean, we were discussing, as MEP Caceres said, when you are running, it's always difficult. I think what we did in March 2020 and that year was actually pretty exceptional in terms of public-private partnership. And we like that, you know. Sometimes we have to recognize, sometimes the Commission is not so open, and we can respect that. But at that time, it was crisis, we met and we tried to fix it. I think we need both, as we were mentioning, and MEP Sokol was mentioning that also. The national level is important too. So you need an EU reserve, stockpiling reserve. That's where the MFF should be, definitely. And you need certainly at national level, because you will have needs at regional level, you were mentioning, which are necessary. The managing authority in the regions will have to do the procurement and so on.
Yeah,
so it can
also
work.
the European coordination on the topic.
Yeah,
That's
why I think we need HERA, a strong HERA, we need a strong commission.
For example, the critical medicines access is the...
You allow me just to finish.
Yeah, Christian, I'll come to you next.
I'll give you to, just to say for us, whatever the name of the organization, HERA, Sanko, I mean, but we need a strong European Commission here to drive it. So we have the DG HERA, is very good. And the last comment for me is really, I come back to quality. The conversation we had in 2020, they say, oh, price was important, but no, we did not talk price. We say, okay, do you have availability? Do you have quality for the people to keep the respirators all day long? And that's what the conversation. So we really stress the need for quality in the selection criteria, because it will benefit all of you, all of us.
Mm-hmm. Yeah, well, something, for example, also in the state of the COVID crisis, also with pharmaceutical companies, from the European Medicines Agency, we had initiatives to talk about with the pharmaceutical companies, for example, to increase the production of propofol, where we had an immediate shortages, for example. So that worked. But coordination is everything. Like Thomas said, that's a very important topic. And for example, in the Critical Medicine Act, there's this talk about the Critical Medicines Coordination Group. So that will at the end help to. So it is something on the national level, but when coordinating it, you could have sufficient supply, but also prevent waste. Yeah. So also sustainability of these, so we do not lose these kind of products. So, and then on shortages, still HERA is something doing on crisis preparedness, but at the end also in the Critical Medicines Act and in the Critical Medicines List, we have to create better systems than we have now in place to also inform all healthcare workers on shortages and alternatives, for example. So there are some countries there where those systems are in place, but then it has to be developed other than what we do now at the European Medicines Agency on information from the producers.
Well, I also wanted to ask you, when it comes to, of course, joint procurement offers economies of scale. It also offers the opportunity for those smaller countries not to be left behind.
Yeah.
But do we need even increased granularity when it comes down to local level, if crises or experiences of different crises is different in different places or different hospitals?
What we saw from the COVID crisis, the situation was the same all over Europe. So that's really not the case. So, and if we really want to be a European Union, then we have to have solidarity. And this, what was discussed earlier, this distribution system for example, then in the Critical Medicines Act, that will be very important, because also, for example, the smaller countries will not be capable to get these products off the markets. And then let be really realistic. We are a very large economy as the European Union. This is why should we do procurement in every individual country? So that will be easy for France and Germany, but then smaller countries like Bulgaria, but even the Netherlands, then it's a topic. So if we join the efforts in that, then we can have good quality, also at a reasonable price.
I think this is a good point to take a question from our audience. Mike Androsau is talking about rotation. So he mentions that influenza is the #1 pandemic risk, but stockpiling vaccines has limitations.
Yeah.
Should we be planning rotating stockpiles of antivirals, which might increase quantity without waste? Christian, do you want to tackle that first, and then perhaps I'll turn to you?
Yeah, I think especially on vaccines, that's because they have a limited shelf life. So that's an important thing. So what we see, especially on, and then every influenza vaccine is every year different. So we only can do a few strains of influenza in it. So that's a really difficult topic. So I think from my point of view, from the doctor's point of view, it's very good that we have the vaccines. You have a closer look on which strains we have, and then you prepare for vaccination of the people who really need it. So that's the elderly and people with more comorbidity. So you really can prepare for that. Also on COVID, we continued to take the vaccinations for the people at risk. But also for now, for example, I took my COVID vaccine because I'm working on the emergency room. So I do not want to pass COVID to a critically ill patient. So we can prepare for that. So the real, so I think that is in every country is in place. But then still, what are we going to do with the new virus? And then, so I think there is now better preparation in what we have learned. And now with HERA is also taking preparation for that. But then still, on the new virus, you have the development time of a new vaccine.
And let me turn to you and get your or HERA's thoughts on stockpile rotation.
Yeah, rotation is it's a key component of the management of a stock. And when you consider strategic stockpile, very often we are talking about medical countermeasures that are difficult to rotate because they are not part of a routine use in the hospitals. And also, if you have built a stockpile worth 1.2 billion, you want to make sure that you keep your medical countermeasure until the very end in order to donate them or to distribute them if they are needed. So it's very important to balance what can be rotated and what cannot be or should not be rotated because it has a use until the very end and even sometimes beyond because we are looking at the possibility also of extending the shelf life of some medical countermeasure. So rotation of PPEs, for instance, is feasible. It should be embedded into the contract when we sign a contract with the member states for establishment of a strategic stockpile, but it's not for all the medical countermeasure.
I think obviously this shows that you need expert opinion to come into this. I have a question here from Aaron Smethurst to the MEP colleagues. Asking who should we reach out to in the member states to promote increased investment in EU-wide health and transport medicine procurement? He's representing Chinogi. He's saying, so where do you go? Where do you put the political pressure on? Where's the lever? Thomas
Ministry of Health as the first instance, and then the Ministry of Finance, because Ministry of Finance, Ministers of Finance will be the ones who will be negotiating the budget, of course, with the prime ministers, with the heads of government, but Ministers of Finance will have a major role to play there. But I just wanted to come back on public procurement. So in the Critical Medicines Act, we are precisely doing that. So we are now prescribing that lowest price will not be the only criterion, that other criteria have to play a part. So for instance, security of supply, transparency of supply chains, etc. But the main criterion should be, and this is what we are pushing strongly for, is buy European. So if you have a significant proportion of your production in Europe, let's say 50% of your active ingredients or of final medicinal products, then in these kind of cases, then you will have priority, you will have preference in the public procurement. By doing that, we are trying to stimulate, provide incentives for the companies to reshore as much production to Europe or to retain as much production in Europe as possible, because we are in a global competition now. I would say in a situation where the brute force has taken over international relations. We have a Trump who is putting enormous pressure on pharmaceutical companies and making contracts worth tens of billions of euros of reshoring production to the US of innovative medicines. And if you don't do anything to prevent this from happening, to attract production to come to Europe, then in 10 or 15 years' time we'll be even more dependent than we are now. We are already to a large extent dependent on imports of antibiotics from India and China and active ingredients related to that. We are not that much dependent on import of innovatives, but if we allow Americans to force the production of innovatives to move to the US in 10 or 15 years, we'll have a big problem there as well. So in this global competition, we have to look at our own interests. If that is protectionism, so be it. but definitely we have to protect European interests, and we have to use European legislation to stimulate production in Europe as much as possible. And this should be one of our main priorities, and I hope that the Member States and the Council and the other political groups in the Parliament will support this approach, and that Critical Medicines Act will be adopted as soon as possible, because we don't have time to lose, because the others like Chinese and the Americans are pushing very strongly to attract industry to their territory, and we have to do something about it until it's too late.
Maxime, I know some of this will be music to your ears because 3M, it's global, it's international, but you prefer to focus more on where production is than HQs, as it were.
Yes, it's a very fair point. There is a conversation which, as a European citizen, it's obvious and it's fair that the legislator and the European politicians want that we manufacture in Europe. For us, we are with that. Today we have 25 manufacturing sites in Europe, so that's why I want fly to quality, because then we can keep our. That's the point also of the public procurement, is we can manufacture in Europe, but we need to be sure that we will have some selection criteria which are favoring quality. Otherwise, if it's on a price, as you said, we will not be able to survive here. But I think it's a very fair point for us. We are global. I am supporting our manufacturing in Europe. If it's manufacturing in Europe, it's okay. Indeed, there was a conversation, in some sectors, we understand on headquarters to be in Europe. We think that's disproportionate. To have a European preference or preference for manufacturing in Europe, that's fair. But let's dissociate, frankly, otherwise we will not be able to serve. Our 13,000 employees are like me, they are not like, I'm not from New York City, you can hear from my accent. So they are all very European, very national, all of us around the table. So these are European citizens, and we need to focus on where we manufacture exactly.
No, we are not referring to the headquarters of companies or the ownership of companies, but where the production is.
That's where the production.
Yeah.
But let me mention one thing regarding this. But first, regarding member states, I have to say that it's not only Ministry of Health or Finance. For example, in my country, that is a very decentralized one. We have a Ministry of Health in every region, and a finance minister in every region that gives the money for health and make the purchase of the medicines and the medical devices. So it's very important sometimes to have a good coordination in the member state and good information for the Commission, because the Commission cannot go for every single region of Europe taking the information. So the different levels of governance are really important to take into account, because, for example, in my country is what it is. The health system is on the region, and then the Ministry of Health of Spain has the duty to coordinate all the regions. But he has not the money, or she has not the money to do so implement the conditions. And regarding the new threats from the US and this Trump blackmail saying to some European companies, come to the US, because if you don't come here, you won't have the same conditions, and you have to lower me the prices as the prices are in Europe, in the case of medicines. I think that is not acceptable. So we have to give more to those European companies or to those European manufacturers that can be companies based in other places of the earth, of the planet, that give more to those that really trust in Europe and really believes in their European capacities. I think that is our duty as European policymakers to say we have to bet on them better than bet on those that are falling under the Trump's threat. So this is the moment, and to give real power to our internal market. We cannot forget we are 450 European citizens. Yeah, we are a small part of the world. It's true, but we have a lot of power in our market. So I think the first movement should be from the Commission, and it's not a HERA duty, is to remove some of the barriers that we have internally. When a 3M manufacturer, 3M seller wants to go for different countries, they have a lot of problems. They have a lot of jumps, things to jump over. And I think to removing these barriers, we will obtain more benefit than the tariffs are supposed as a burden for European manufacturers. So time to think about it. It's not on the table, the response, but it's a common response for all Europeans.
Very holistic, and also feeding into the EU competitiveness agenda and the transitions and everything else. So we don't have time at this point to go into all of that
Of
at
course.
the moment. We have just a few minutes left, so I'm going to ask everyone just for maybe a minute or 30 seconds, a minute of a wrap up and a takeaway. And I'll start with you. Anything we should be looking to the future? Any new proposals for 2026? Or what would you like people to take away from our discussion?
No, what I would like people to take away is that we have a very ambitious agenda. We talk a lot about health threats, serious cross-border health threat, but we should not forget also the threat coming from conflict. So it's really time for us to implement what we have proposed in our strategies, and that's the wish I would like for 26, that we have the means and resource to implement those activities.
For me, it's very important to say that we are making new legislation. We have to give this legal framework time to be implemented. Now, having omnibus is a trend in this Parliament and the European institutions. But all the omnibus are not meaning all the time simplification. Sometimes it's the regulation. So give no time to the European legislation be put on place and functioning for the citizens. So we have to stop this trend a little bit. Simplification is good. The regulation is not an European solution.
Tomislav?
So the history and experience shows us that in case of crisis we have to work together, that member states cannot resolve these problems by themselves, problems of health emergencies, crises, pandemics, etc., even the biggest ones, not to mention the smaller ones. So we have to work together, and we have to be as independent and autonomous as possible. So not depend on import of medical countermeasures, of masks, of ventilators, of critical medicines from other countries, because in case of crisis, everybody first looks after themselves. So common European policy, common European coordination, common European stockpiles when they are necessary, but working jointly and focusing and strengthening our autonomy from others, which means boosting production in Europe, which means stimulation and using the leverage of our single market, I agree, which is very important, and be as sovereignist in that sense as possible. One thing that I agree with the socialists, and I don't agree with them very often, is the fact that this so-called deal with the Americans was also sent a bad message. Sent a message that we are weak. We are not weak. We have the second biggest, let's say, market in the world. We have a lot of leverage there. We have strong technology. We have good universities. We have good experts. We have a lot of production still in Europe. So we have a lot of instruments, a lot of leverage, a lot of strength that we can use to strengthen our preparedness and resilience, to work together and to not to be dependent on the others. I think that's crucial.
Christian, what
I'm
should we...
not going to repeat because I totally
Yeah.
agree. We are looking forward, especially also to the Critical Medicines Act and the measures that are taken there. We made some comments on that. So at the end, it's the most important is coordination and solidarity within the European Union. And for us as doctors, but also, for example, for the pharmacists, I think that's one topic that I try to address just now, that we need more information about which shortages are there on the national, easy, accessible, and also to see what alternatives there are. We in Netherlands, we have some systems in place, Germany also, but we can improve that on the European level, also to improve this coordination and cooperation. But then also we have to be, we need also to have this redistribution mechanism.
Maxime, final word.
Takeaways first, I think we have a great opportunity now.
Yeah.
The good news is we have a policy framework which has been on the table and it says everything. So for us as an industry player is let's get the budget, let's get some centralization, but not for the sake of centralization, but for efficiency. And it will be both at EU level. We think we should have a strong EU role here with the Commission in the driver's seat, but let's execute. And the third point is, you have heard me say already, but it's really, let's have a flight to quality. Because if we have quality, it means we have jobs in Europe.
Thank you very much. I think a fairly unified response there from all of you to take away. So thank you all very much for this interesting conversation. Thank you as well for joining us, and to 3M and Euractiv and our hosts here at the European Parliament for hosting us today. And of course, you can find out more about Euractiv debates on events.euractiv.com or by following the hashtag EA Debates online. That's it for today. Have a great afternoon.